I had to stop the video before I was finished, and now we'll continue on with the rest of the blood vessels and an athero and arteriosclerosis. So capillaries, as you can see, vessels with just a thin tunica interna, like I said, large enough for red blood cells to slip through and designed for exchange. So here's the information about continuous. The key being the tight junctions, uninterrupted lining. And notice too, brain capillaries, as I mentioned, more complete and form a blood-brain barrier with the astrocytes. Fenestrated, some endocrine glands, yes, definitely endocrine glands, and the small intestine and the kidneys. I was thinking sinusoid, because I wanted to talk about here in the adrenal medulla, which is also an endocrine gland, we have the sinusoid capillaries as the exception. Notice also in lymphoid tissue and tonsils and lymph nodes and those kinds of things also will have sinusoid capillaries. And one of the reasons, besides being able to remove and destroy bacteria, is gives the liver time to process the glucose and fat soluble vitamins and those kinds of things that the liver is responsible for once we have the hepatic portal system. Oh, and portal systems. I'm going to tell you about that too. So we'll get to that shortly. So here we have the, like I told you about how the sphincters work, and told you all about that. And the postcapillary venules, as I also mentioned, very porous for fluid and white blood cells to leave, and margination happens. And then the larger venules will have a very thin tunica media and externa as those layers start to come back. Talked about all of this information, walls being thinner, but all three tunics are present. Little smooth muscle in the tunica media. 65% of all of the blood is found in the veins at any one time, and the function of the valves. And also, as I mentioned, most of the valves will be found in the veins of the limbs, where they're acted on by gravity more than some of the other parts of our body. Here was about varicose veins, is due to incompetent valves. Gravity and pressure affect them, and then an anastomosis is either a vein to a vein, an artery to artery, or an artery to a vein. Here is an example of a varicose vein on the left, and you can see there's a valve right there. And then after treatment, how much better it is with laser treatment, and used to be strip them out and cut them and resection them, but we have new techniques 35-40 years later that work much better. I like this diagram that shows how veins are supposed to work, as opposed to these incompetent valves, which allow blood to go any which way that it wants to. Okay, I'm going to skip through because this is all another lecture, and get into, sorry about that, do that in another one. Okay, so here we get to atherosclerosis and arteriosclerosis. So atherosclerosis is when the blood vessels become blocked with plaques and inflammation, preventing the flow of blood through the vessel. Arteriosclerosis, on the other hand, is essentially a hardening of the walls as a person ages. Arteriosclerosis is more a function of age, where atherosclerosis is more of a function of lifestyle. In the cadaver that I have at my school, usually my cadavers are elderly, and this cadaver is no exception. And when you squeeze the arteries, you can feel the crunching of the calcium deposits in the wall, which is a classic example of arteriosclerosis. And so what that's going to do is reduce the elasticity of the blood vessels and make them much more stiff, and then contribute to hypertension, which is a lot of times what my cadavers die of anyway. Atherosclerosis, though, is going to happen typically as a result of inflammation and, of course, having too many LDLs with cholesterol. So if we look in here, usually the aorta and the coronary arteries are most affected, and I'll talk about why in a minute. Whenever we have damage to the endothelium, we're going to have repair processes that happen, and if we have too many LDLs and too much cholesterol present, the macrophages that are going to come to the area are going to engulf the LDLs, and then we get the development of foam cells, and these foam cells will enhance plaque formation. We'll start to get platelets clinging to the area. We'll get clotting factors sticking, and then we'll get the development of a whole lot of tissue that's going to reduce the size of the lumen and really impair the blood flow through that vessel. Let's see. So when we have this extra cholesterol in these foam cell macrophages, will proliferate the tunica interna, and the media will also work to decrease the diameter of the lumen, and then we can get thrombi, and they can block even more. Let me show you this picture first of an atherosclerotic vessel. So here you can see all the clotting and plaque and buildup that we have within this vessel, and therefore the lumen is going to be very, very small compared to how large it's supposed to be, and so then the blood flow through this area is going to be greatly impeded. So what do we do to well, first of all, what causes it? So we got that cholesterol and LDLs. In your study guide, it says, what are some of the factors that can increase your risk for developing atherosclerosis and arteriosclerosis? Well, lack of exercise and a very poor diet. If you have a cholesterol-rich diet, if you're eating a lot of animal meats, and what other kind of meats are there? Eating a lot of cholesterol-rich foods and not eating a lot of fiber, although we're not sure exactly the link between fiber and lower cholesterol levels, but fiber and vegetables are always a very, very good idea in our diet. And so one of the questions in your study guide is, what are the signs of heart attack? Was the best treatment for a person experiencing heart attack? So obviously signs of heart attack: pain in the left arm and down up into the neck, down the left side of the body, indigestion, feeling like you have heartburn, sweating is definitely a characteristic of having a heart attack. Pallor, maybe even gray, lightheadedness, and so what we want to do is get them medications to help reduce the blockage of the heart as quickly as possible. Short term, and then long term, what are we going to do? We'll try to reduce cholesterol and LDL levels, raise HDL levels, reduce inflammation. We have coronary bypass surgery, balloon angioplasty, wire mesh stents, and typically change your lifestyle. There are a few reasons why hearts seem to be the most susceptible to atherosclerosis, and I'll have that information in the heart lecture all written out, but I'm just going to quickly tell you. So there's a few reasons, about 3 reasons why we tend to get a lot of blockage in coronary arteries, and the first one is that once the blood leaves the heart through the aorta, the very first vessels out of even the ascending aorta, not even the arch of the aorta, but the ascending aorta, are the coronary arteries. So they have the absolute best blood that is leaving the heart to go out to the rest of the body. So it's going to be very nutrient rich. Hasn't been anywhere yet, so it's going to have some fat and other material in it that can cause, I shouldn't say fat, but triglycerides and LDLs shuttling cholesterol, and so that will be there in abundance. Probably more than any other capillary bed that you have will be the capillary beds within the cardiac muscle itself. So that's one. Second reason is that the blood vessels in the coronary arteries are very, very small in diameter. And the smaller the diameter, the easier it is for stuff to stick to the inside, because you're trying to shove thicker material through a smaller opening and stuff's going to stick to the sides. And so because the coronary arteries are so small, that we tend to get material depositing in the walls. And the third reason is because they bifurcate a lot. Those coronary arteries split very quickly and a lot as they're carrying the blood out to the cardiac muscle. And whenever you get a bifurcation or a fork in the road, that's where the material is going to stick. So, you know, if you're going down a stream and you come to a sandbar, there's a lot of material stuck at the top end of the sandbar as the river may be split by that sandbar. And the blood vessels are the exact same thing. So whenever you come to a bifurcation, then material will also readily deposit there. So those are the three reasons why we tend to have blockage of the arteries in the heart, in the coronary arteries, than a lot of other places. Okay. Oh, portal systems. I have in my notes for my classes that I teach, I have the portal systems in their systems. I don't have it in blood vessels per se. So the first portal system, hypophyseal portal system, is between the hypothalamus and the pituitary as it passes through the infundibulum, and is going to carry the hormones, the releasing hormones from the hypothalamus down to the anterior pituitary. So a portal system is where you have a capillary bed and a vessel in between, whether it's an artery or a vein, and then another capillary bed before it goes back to circulation. So in the hypophyseal portal system, we have a capillary bed in the hypothalamic. No, that's hypophyseal portal system. That's right. In the hypothalamus, and then the portal veins in the infundibulum, and then another capillary bed in the anterior pituitary. The second portal system is the hepatic portal system that we find associated with digestion, where the capillary beds from the villi in the small intestine will travel through the hepatic portal vein. There are a lot of vessels, left gastric vein, splenic vein, superior and inferior mesenteric veins, all feed into the hepatic portal vein, which will then go to the capillaries of the liver, and the blood will be processed by the capillaries of the liver, and then that blood will leave the hepatic vein and will go back into the inferior vena cava and back to the heart. So that's the second one. The third portal system we have within the kidneys. So as blood goes into the kidneys, it goes into what's known as an afferent arteriole to each nephron in the kidney. Then it becomes a cluster of capillaries called the glomerulus. Then the blood will leave the glomerulus through what's known as the efferent arteriole. And then the efferent arteriole will become another capillary network called the peritubular capillary network, which surrounds the nephron. And then the blood will go from the peritubular capillaries into the interlobar veins, and then arcuate veins, and then interlobular veins into arcuate vein, and back into the interlobar veins, and then into the renal vein, and then out of the kidney. So that's a third portal system, but that's interesting because we have a capillary bed, we have arterial, capillary bed, arterial, capillary bed, and then into the veins. So those are the portal systems that we have within the body. So so I'll stop for this one, and then I'll go into capillary exchange, the pressures associated with that, and then regulation of blood pressure.